Hello, welcome everyone.
Hello,
I am Dr. Mohan Raut.
I'm Dr. Mugdha Raut.
Both of us are practicing gynecologists. We have our center, Dr. Raut's Center for Reproductive Immunology, and in this center, we treat couples who have repeated miscarriages, recurrent IVF failures, and unexplained infertility using immunomodulatory treatment like lymphocyte immunization therapy and other immunomodulatory medications. Today, the purpose of our meeting is little different. All of you are aware that breast cancer is one of the commonest cancers found in women. It has been responsible for a lot of mortality and morbidity, and therefore it is very important to be aware about this disease. Also, it has been found that if we diagnose this or come to know about this disease early, then we can effectively treat it and we can get a cure from this disease. And keeping this thing in mind, month of October every year has been declared as Breast Cancer Awareness Month. So in this month, a lot of activities are done to create awareness about breast cancer among common people, amongst doctors, so that the disease can be diagnosed in time and treated effectively. So for this purpose, we have invited a special guest today to have interaction, and we have with us Dr. Rashmi Mehta, a general surgeon practicing in Santa Cruz with special interest in breast disease and anorectal diseases. Welcome, Dr. Rashmi Mehta.
Hello, hello. Hello, Dr. Mugdha. Hello, Dr. Mohan. Thank you for having me here. It's nice to be here.
Thank you, Rashmi, Dr. Rashmi, to be here with us. I think I will tell Dr. Mugdha to introduce Dr. Rashmi briefly.
So, Dr. Rashmi Mehta is a general surgeon practicing in Santa Cruz East for more than 20 years. And she has a very special interest in breast disorders and anorectal disorders. So, today, Dr. Rashmi Mehta, let me start with the first question. Why is the October month considered as the Breast Cancer Awareness Month?
Okay, so about 4 decades ago, sometime around in 1985, October was declared as Breast Cancer Awareness Month, and 21st October was declared as Pink Ribbon Day. The aim is to increase the early detection of breast cancer by teaching women about breast self-examination, encouraging them to show or consult their doctor for their breast problems, and to get a mammography done as required. This is because the incidence of breast cancer is increasing all over the world and in India also. According to a WHO report, there are 23 lakh breast cancer cases detected every year, and out of which 6.7 lakhs die. According to a Globocon 2020 report, there are 1.78 lakh cases of breast cancer in India itself, out of which 90,000 die every year. And this number is likely to increase only. It's going to likely to increase up to 1.9 lakhs in the next couple of years. So it is very important to have awareness so that it is detected early and treated in time.
Dr. Rashmi, one question always comes to my mind, that is this a disease of only old people, or can you elaborate more on that?
No. I'll give you an example. There was this patient, fictitiously, her name is Deepa. She's a 23-year-old girl working as a receptionist with a doctor. And on the threshold of marriage, she came to me with a breast lump. I investigated her and it was found to be a breast cancer. Fortunately, it was detected on time, and now, 18 years later, she's quite well. She's got married, she's had children, everything. So, all over Asia, the demographics of breast cancer are changing. Instead of older women, there is increasing incidence in women of age less than 45, even young girls as young as between ages of 19 and 22, which is worrisome. And in India, urban women are getting more and more breast cancer. It contributes to between 25 to 32% of overall cancer cases detected in India, in urban India. 1 in 24 women are likely to get breast cancer in India, which is a large number by itself, and this number is going to go higher still. So this is increasing the challenges for the treating oncologists and the government, because more and more younger women are getting diagnosed with breast cancer.
So, Dr. Rashmi, do you think the incidence is increasing over these years, or is anything that is contributing to such changes?
The awareness is also there. The awareness is increasing, but in India, it is like even the cases are detected later. Patients are delaying going to the doctor. Patients are not having access to healthcare in some places. So the death rates are also higher. But the incidence is increasing. Now there are two kinds of factors in this. There are modifiable factors and non-modifiable factors. The non-modifiable factors are of family history. If you have a strong family history of breast cancer, you are more likely to get breast cancer. Then there are other factors which are not modifiable, like age at menarche. Menarche is when the first period comes, and age at menopause is when the period stops. So if the gap is wider, the age is earlier in getting the period and later when the period stops, there is a continuous stimulus of estrogen, and that causes increased risk of breast cancer. Same goes for women who don't have children, who don't have not had any childbirth, where there is continuous stimulus with the hormones on a continuous basis, not interrupted, as well as women who are who choose to have childbirth after the age of 30. They get a continuous stimulus of estrogen, and the risk of breast cancer in these people increases. Now, this is very controversial now. Nowadays, more and more women are opting to go for childbirth in their 30s, after the age of 30, because they choose their career over childbirth. Now, this is risky and it has a price to pay in terms of breast cancer. So, at least the women should be informed about it, and an informed choice should be made about them after knowing that the chance of breast cancer can go higher the later the age of childbirth. These are the non-modifiable risk factors in terms of menarche and menopause, but there are modifiable risk factors. Women who are having a particular kind of lifestyle, smoking, drinking, past life, these can be changed because these can increase the risk of breast cancer. Say lifestyle changes, having a healthy diet, having citrus fruits, fermented foods, less fatty food, but fatty fish, more vegetables, legumes, spices, and herbs. Maintaining an optimum weight, avoiding putting on weight even after menopause, because all the fat is accumulated. Accumulates estrogen in it, and that continuous stimulus of estrogen can increase the chance of breast cancer. Staying physically active, cessation of smoking, stopping of smoking completely, and limiting alcohol only for certain occasions helps in reducing the risk. This is a modifiable risk factor. Another thing is breastfeeding. Many women don't do breastfeeding, but continuing breastfeeding for up to 1 year after childbirth is a protective factor in order to prevent getting breast cancer. Now, another thing is, which you will be able to tell me better, is limiting post-menopause hormone replacement therapy. You tell me about, what can be done about that? Because postmenopausal HRT, hormone replacement therapy, can also increase the risk of breast cancer. So, are there any advances in that?
Yeah, so hormone replacement therapy, ideally, according to the WHO, using hormone replacement therapy after menopause does increase the risk of not only breast cancer but also uterine cancer, and especially the HRT which contains estrogens. So basically, what we as gynecologists feel is that if you can use something which is non-hormonal, will always be safer in these terms. And the second thing is moving on more to progesterone based hormone replacement therapy. So that should probably help in reducing the risk of breast cancer. But yes, using something which is non hormonal is a completely different, it can completely prevent it where we can prevent it.
So, what non-hormonal methods would you advocate? I mean, instead of HRT?
Yeah, so non hormonal methods are basically a very good lifestyle, as you already said about maintaining your exercises, your a good diet, and keeping your mind occupied. That is one thing. Second is it has been proven that even meditation is known to help in reducing the risk of the side effects of menopause. That is mainly what it is: hot flashes or sagging of the skin or other issues. Then a lot of isotonic and isometric exercises are something which really help in preventing any bone issues, skin issues. And another important thing is soya isoflavones. So isoflavones, they mimic the estrogen. They make the body, they sort of attach to the estrogen receptor, and the body begins to feel like they're estrogens, but they are not estrogens. And it adds to the safety. If a woman wants HRT, it adds to the safety of HRT.
That's right. I think the way what you told Dr. Rashmi, it looks like the incidence is increasing and the reasons are there, some of which cannot be controlled. But then the best way I think will be then to find it out early or diagnose it early before it becomes severe. So how can you elaborate on that? If we can, how can we diagnose it early?
Every young lady should be taught breast self-examination. Usually, it is done at regular intervals, generally 7 days after the period gets over. It's very simple, and the details are all available all over social media. Many social media platforms it is available. But examination of the breast in the mirror and palpating or feeling the breast in the lying down position systematically are the basic steps. This way, if the lady or the woman examines herself every month, the chances of detecting a breast cancer early increase manifold. So, breast cancer usually presents as a lump or there is asymmetry in the breast. That can be taught to the patient how to find out, even with just regular examination. Pain is there, but not always in the beginning. So, pain is not a symptom to start with breast cancer. Other things to look for are thickening of the skin, or redness or flakiness of the nipple and areola, or pulling of the nipple or discharge from the nipple. Also, lump in the armpits, axillae, what we call medically, but common word for it is armpits. So these are the things that the person has to look for. Also, the change in the size or shape of the breast is something else that they can look for. That is one way to detect. The next thing is mammography. Mammography is an X-ray of the breast. So there are no specific guidelines for India, but generally after the age of 40, mammography should be done once a year or twice a year, depends on the patient situation. Say if the patient has a strong family history or they have a lump detected earlier, then they should go every year. Otherwise, twice a year, once in 2 years. So US Preventive Services Task Force has mandated mammography between the ages of 50 and 74, whereas the European guidelines are stating that the ages should be between 50 and 74. Generally, up to the age of 55, it should be done once in a year, and then 55 onwards till 74, once in 2 years. So, if for some reason mammography is not possible, then tomography can be done, MRI can be done, or even ultrasound sonography of the breast can be done. So, this can help in detecting breast cancer.
Dr. Rashmi, I had one query because a lot of patients ask me about this. Is they are afraid of mammography because they feel that there is a lot of radiation and it can cause other cancers. Radiation can cause other cancers. So, can you just elaborate about the safety of mammography?
So, see, the radiation, radiation is measured in millisieverts, and the radiation caused by mammography is zero point 0.4 millisieverts. This is equivalent to 6 months of background radiation that any person would face in day-to-day living. So, the radiation dose is very small compared to the benefit that can come from detecting an early breast cancer. So, the patient should not worry about this on this count, especially when there is something definitely palpable or felt. Then the patient should not worry about the radiation dose. Very small.
Acha, so I think there is no need to fear about mammography, especially the radiation part. Some patients say it is painful, but I think
if it is done at the appropriate time, now see, if it is done just around the periods or when the periods are due, it is more painful because there is little heaviness or congestion of the breast. But normally, the mammogram is done mid-cycle, halfway between the two menstrual cycles. The pain is very negligible. I mean, the benefits are there, so little bit of pain if is there, the patient has to bear with it. But if the diagnosis is made in time, it is definitely worth that little bit of pain.
Dr. Rashmi, you mentioned about breast self-examination. So, say on this examination, if a lady feels a lump, so is it immediately should be considered as cancer, or all lumps are cancerous, or can you?
All lumps are not cancerous. There are a variety of reasons where a person can have a breast lump. Some common, see, 9 out of 10 are not cancerous. And some of the common reasons could be a cyst in the breast, fibroadenomas, adenosis, papillomas, duct or globular hyperplasia, even fat necrosis. Sometimes it's just mastitis, which is like an inflammation or a swelling of the breast. It's not a cancer. So we have to rest assured that 9 out of 10 are not, but they should go to a doctor and get themselves checked. Definitely. And then if it required, the doctor will advise a mammogram.
Yeah, I think it is really good because the patient, I have seen patients who have spent sleepless nights that they have felt the lump and then they are so scared to tell doctor that they feel what if it turns out to be cancer, so they don't tell and then just worry about it and finally it turns out to be something benign, as you said, maybe.
That is why this awareness month is there, to make you aware that not every lump is a cancer, but at the same time, go to the doctor early so that something, if it is there, is picked up early and treated well in time for you to have a hassle-free life.
So then, when there is a lump detected, how do you confirm that it is breast cancer or it is not cancer?
So what is done is a core biopsy. Core biopsy is where, under sonography guidance, a little thick needle is used to puncture into that lump, and bits of tissue are taken from the lump, which are sent to the laboratory for testing. This confirms the diagnosis, and at the same time, from this very sample itself, there are some further tests done which help to know what kind of tumor it is, which helps in planning for the treatment of if it is a cancerous tumor.
Just with a core biopsy.
The core biopsy, you get to know whether it is a cancer or no. If it is not a cancer, well and good, we are all happy, and that's fine. But if it is a cancer, then what kind of cancer it is, because that treatment has to be planned, the chemotherapy has to be planned. So it helps, what is known as hormone receptor studies. That all can be done with the same sample in the core biopsy.
And any blood tests are also helpful? Are they done with?
Blood tests are the gene tests that are done, which
no,
are
for the
not helpful
diagnosis.
in this thing. For diagnosing, not specifically a blood test, the routine tests are done, but to confirm that it is a blood cancer, you do need a core biopsy. You need actually material from the tissue, because no blood test will tell you that you have this cancer or no. You need material from the tissues.
Yeah, it is, I think, very important to stress that, because patients sometimes feel that if the needle is put inside, it may, what if it spreads?
And spread, yeah. So there are some patients.
But the thing is, the needle is thick, but it is not that thick. And yeah, I had this patient once. She was a doctor herself, but she got so scared that, doctor, you put that, I'll get a spread. just have to reassure them that no, that needle is this thing, and supposing it's a cancer and that cancer needs to be removed, well, your needle is going exactly over it, so that part gets removed automatically. But basically, a reassurance is all that is needed. It is not going to spread everywhere just because you put in a needle. And you need a diagnosis for further treatment.
So then once it is diagnosed as breast cancer, what is the treatment available on there? Because there have been a lot of changes happening in the treatment of breast cancer. So can you elaborate in that?
A lot of advances have taken place in the treatment. See, previously it used to be breast cancer means the breast has to be out, and that could be very devastating for any woman. Now, what is primarily offered, depending on the kind of tumor, what is primarily offered is breast conservation surgery, PCS, where only the cancerous part and its surrounding tissue is removed. This is accompanied by chemotherapy given before the surgery, which is called neoadjuvant chemotherapy, and chemotherapy given after, which is called chemotherapy and radiation therapy. Also, there is hormonal therapy, which is an option depending on the patient's report. Newer treatment options are there like targeted chemotherapy, immunotherapy, as well as focused radiation. Breast conservation surgery is also accompanied with the oncoplastic surgery, which is cosmetic surgery of the breast, which helps to give a good result, good appearance of the breast, and this boosts the woman's self-esteem also. So, yeah, a lot of advances are there, definitely.
So yeah, so it means that it is possible to conserve the breast also if it is detected in the early stage.
Actually, now the trend is to try and conserve the breast as much as possible. Again, that is why the awareness for early detection. When you have stage 1, you can conserve. But if a patient comes with stage 4, it is not possible to conserve the breast. So the awareness is there. You examine yourself, you be aware of the breast and aware of the lung, come to the doctor early. That is why the breast cancer awareness month is there.
So, Dr. Rashmi, you told about we should be aware about it. You can diagnose it early. But the best way is, can it be? Is it possible to know who is likely to get breast cancer, and you can prevent it from the beginning itself? So, are there anything which can predict that particular lady is likely to have breast cancer?
Okay, so see, hereditary causes of breast cancer, the hereditary factor, inherited tendency to breast cancer is there in 5 to 10% of breast cancer patients. So, if your mother, if a patient's mother, sister, or daughter has got breast cancer, the chances of you getting diagnosed with breast cancer are much higher. And the common cause for this is the mutation in a gene called BRCA, which is breast ka BR and cancer ka CA. BRCA gene, BRCA1 and BRCA2, these are the genes where some mutations or changes occur, and this can increase the risk of getting breast cancer by 80%. Now, this gene is passed on to the male and female offspring also, both. And in the females, there is an increased risk of breast and ovarian cancer, but in the male, there is increased risk of prostate and breast cancer.
Oh, so you mean even the breast cancer is seen in men also?
Oh, yes. 1 in 100 cases of breast cancer is in a male. It is seen especially in those with a strong family history, but it can occur in others also, even without a family history. So a male should also look for any abnormalities in his chest, get his self-examination regularly. He should also check out for it, because male breast cancers are more aggressive than female breast cancers.
So if the male has his mother or in the family they have breast cancer, so it is required that he also should test himself.
See, BRCA gene testing is necessary in first degree relatives, definitely. Any first degree relative of yours is diagnosed with breast cancer, it is better that all the first degree relatives, the mother, the daughter, son, brothers, everybody gets tested for BRCA genes. Because see, BRCA gene gives you an idea about being more vigilant towards self-examination. Say it is positive, you are more vigilant towards self-examination, going to check up with your doctor, as well as doing a mammography as and when advised. Of course, not having a BRCA gene positive doesn't mean you will not get breast cancer, but when you know it is positive, you are a little more vigilant towards yourself. I mean, even if your BRCA gene is positive, it doesn't mean you shouldn't do a mammography. BRCA gene is just to be more aware. A mammography is to actually detect the lump in the breast. So it has to be done even if the BRCA gene is negative.
So if BRCA gene is there, then that doesn't mean that person will definitely get breast
It
cancer.
doesn't mean you'll definitely get, but the chances are like increased. The risk is increased by 80%. So definitely you should be more vigilant, extra vigilant towards doing it.
But no.
There are other screening modules also, machine learning models that basically compute all your parameters apart depending on demographics, age at family history, age at menarche and all. But again, these are compounded along with lab and mammography reports to give you an idea about prediction. But basically, a BRCA gene, self-examination, mammography, these are all very important.
So just the BRCA gene positive someone did not go ahead and do things like Angelina Jolie, and drastic measures are not required, right?
Now, see, now there are two opinions on this. There are some people who would like to get the cancerous, the risky part out. They do skin sparing mastectomies. But the opposite end, they say, okay, be extra vigilant, go for more regular checkups, go for more regular doctor consultations. So there are two spectrum. The spectrum is there. There are people like Angelina Jolie who just got her breasts out because her mother had ovarian cancer and BRCA gene was positive. And then there are people who just go for regular self-examination and mammography and this. So whether you want to go for drastic or no also depends on the individual mindset, but then both options are acceptable.
So there is breast cancer curable.
What is your opinion?
What is your opinion on that?
When diagnosed early in stage 1, chances of patient who was stage 1 and treated being alive at the end of 5 years is 95%. Like I just gave you this example, this girl is there for 18 years now. But when you come in a stage 4, the same 95% likelihood drops down to 25%. That is why the awareness of breast cancer early detection, that is why the self-examination and early detection is the emphasis is there, because when you are diagnosed early, definitely. Of course, recurrence can occur. It can occur late. So I had a patient who I had operated upon. I done a mastectomy in 1999. Given chemotherapy post-operatively also, and all the way later in 2017 she came to me. So she came with metastatic breast cancer. So it can occur, recurrence can occur late, but then you have a good chance. And see, the overall women are living longer. There are better results oncologically as well as cosmetically. And the patient mindset is also changing. I mean, see, 2 decades back, I had a patient who was detected with breast cancer. She was just sitting in a corner of the house and kept on crying endlessly because she was diagnosed with breast cancer. Now, this year, in April, one school teacher I diagnosed with breast cancer. All she asked me was, Doctor, will my treatment, surgery, and chemo and everything get over by June? Because school reopens in June, I have to resume my job. I mean, she was all prepared. She had even purchased a wig before the chemo started, all ready to face the music and everything, So the patient awareness, patient mindset is also changing. And that is a very good thing. Once they are detected early and they are treated early, it's a very positive thing to have a good early diagnosis, and patients are doing well post-operative.
So as you said, a lot of younger patients are getting affected. So they undergo treatment, chemotherapy or radiation. So this must be affecting their other functions also, other systems also. So you must be coming across such examples.
Like as gynecologists, we are commonly asked about fertility.
Yeah. So see, the thing is, the excess estrogen stimulation is one cause of infertility, correct? And it can be a cause of breast cancer also. And chemotherapy, of course, can cause infertility. So, there are some patients we have to encourage them for freezing their eggs before starting chemotherapy. I mean, what would you, I mean, you must have come across patients who require freezing of eggs. You have any experiences with that? What do you say?
Yeah, definitely. Because if she is detected early, before starting chemotherapy, even the oncologist has advised to do egg freezing, and that would definitely be a very good option because it is very easily available now, and it can be a game changer in their life.
Correct, correct, correct. So, same goes for PCOS. You people treat PCOS more than I see. But again, people ask PCOS causing breast cancer. The excess androgen is predisposing to endometrial uterine cancer, but it is not proven for ovarian and breast cancer. And even those using contraceptive tablets or intrauterine devices releasing contraception, out of 800 such users, maybe one patient would get. What do you say about the risk? Risk of this thing, and what advances are there in that? And what about PCOS treatment per se? What is your opinion?
In PCOS, as you said, that there is excessive imbalance or excessive estrogen, and which acts on different tissues, and definitely there is theoretically also more chance of it affecting the breast tissue or endometrial tissue. One thing is there that many of these patients are land up with infertility, so they have been treated for that. So it fortunately doesn't remain continuously over indefinite years. And during treatment, they are given adequate progesterone, or if they conceive, then everything hormonal pattern changes. So yes, those who have successful treatment of fertility of PCOS, they definitely have reduced chances. But yes, someone who is untreated or who has a very severe form of PCOD can land up with estrogen-induced disorders like endometrial carcinoma as well as breast cancer. So definitely there is increased incidence, but with increasing awareness, everyone is more thinking about this all the time, and programs like this, the awareness programs like this, definitely make them think, and they ask questions to us or to their doctors, and find out, and they were keen to know the solution. So yes, definitely there is
Yes,
increase, but
the awareness is there from the patient side also, and from medically also there has been so much awareness of all that these advances are there about even the way treatment of PCOS is done has changed quite a bit because of this awareness, right? So,
yes, yes. You want to add anything please about PCOS?
No. I think he's spoken complete about PCOS because in PCOS there is also obesity. There has to be a lifestyle modification, and the same factors are important for breast cancer.
correct,
So whether it
correct.
is PCOD or this lifestyle modification, losing weight, exercises is very, very important in preventing any kind of cancer and anything else, any maybe heart disorders, early blood pressure, development of early blood pressure, diabetes. So, in general, PCOS, or what we call now metabolic syndrome, is something which is extremely important in preventing so many disorders.
Correct.
Yes, it is a part, although it has a genetic inheritance. Definitely, what we can do is what is in our hands, we can control. What we can modify in our hands, we can control.
Definitely.
So great. I think today we had covered so many aspects about breast cancer. I think uh, awareness month like this, I think it should not be a month. It should be around the year awareness which should be there, because as you said, Dr. Rashmi, that it is one of the commonest cancers, and it can, if not detected, it is life threatening. If it is early detected, there are 95% chances, but if it is detected in late stages, just 5% chances of 5 year survival. also you elaborated upon the risk factors, the modifiable risk factors, which are in our hand and we can modify it so that we prevent the chances if someone is going to have it, because there will going to be some cases. So how you can detect by examination, and then finally by investigations like the biopsy, and then you can treat it effectively. And also, yes, about BRCA gene, so that we can have some predictive value of who can get. So I think you gave us a complete, I would say, covered the topic completely from all sides, and gave us and the audience uh, good awareness about this disease. And I think we are really thankful to you, Dr. Rashmi, for taking time and coming
Pleasure was mine. The pleasure was mine.
on this program. And I think,
Yeah, Dr. Rashmi, I would like you to give one message in conclusion to the audience.
Now, see, the breast is considered a symbol of womanhood and femininity. So, any disease or surgery of the breast evokes a fear of mutilation and loss of femininity. So, and in spite of our best efforts, cancer does strike in some people. So, just be aware of your body and breast. Get used to the feel of your breast, the cadence of changes that are occurring in your body at every menstrual cycle. Then you can pick up any misstep or recognize anything that is not normal. So take heart and try and lead a stress free life or healthy life. Be aware of your health, be proactive, and early and timely treatment is the key to fight against cancer. Breast cancer specifically.
and one more thing I think I would like to add, that there is a one more message for men, that this is
Yes.
breast cancer is not a women thing, it is for everyone.
Everyone.
And so men also should be aware about this problem and take care about this.
It was nice chatting with you all, and I hope things have become clearer and topic has been covered.
Definitely,
Definitely.
Dr. Rashmi. Thank you so much for your time and coming on the show.
Thank you so much, Dr. Rashmi.
Thank you. Welcome.